minute!
What are you two doing?
They are performing bleeding time in IV method. Bleeding time is the time taken for a standard wound to stop bleeding. But what are the equipment needed? How does the experiment perform? Is there any safety measure? So here we will share more about this topic. Let's come and join us!
This is the procedure of bleeding time by using IV method. Firstly, place a sphygmomanometer cuff around the upper arm of the person. Second, inflate to 40 mmHg of pressure. Keep this pressure throughout the test. Next, choose the area that needs to be punctured. Ensure the chosen area is devoid of visible superficial veins or scar with approximately 3 fingers distance from the elbow. Next, clean the area with 70% of alcohol swab. After that, puncture the skin by using sterile lancet. Start the stopwatch once the puncture is done. Blot off the blood from the puncture using the edge of Whatman No. 1 filter paper at 30 seconds interval. Stop the stopwatch when the puncture have stopped bleeding. After that, remove the sphygmomanometer cuff from the person. Lastly, put on the butterfly bandage at the area punctured. Don't forget to record the time taken as bleeding time.
The time from the beginning of incision until the termination of bleeding is considered as the bleeding time. A standard filter paper should be used every 30 seconds to draw off it until the blood completely stops. Normal value of bleeding time range between 2 until 7 minutes. Quality control is accomplished through the standardization of the procedure. The wound should be a standard length and depth, and a constant pressure of 50 mmHg is maintained throughout the procedure. If the patient has taken aspirin or aspirin-containing compound 7 to 10 days prior to the procedure, the bleeding time may be prolonged. Result may be affected by an improperly performed puncture. A puncture that is too shallow, too deep, or in inappropriate location will adversely affect test result. The alcohol must be completely dried before making the puncture if residual alcohol is on a puncture site. The bleeding time will be prolonged. If filter paper touch the wound, the platelet clot is dislodged, causing falsely elevated result. Test is dependent on adequate number of functionally active platelets that can adhere to the endothelium to form aggregates. the test is abnormal prolonged in bleeding time abnormalities. Next, von Willebrand disease is a deficiency of von Willebrand factor may prolong the bleeding time but not in all cases. Von Willebrand disease causes prolonged or excessive bleeding. The bleeding time is no longer recommended as a test for the diagnosis of von Willebrand disease. Von Willebrand disease is a hereditary deficiency of von Willebrand factor which causes platelet dysfunction. Bleeding tendency is usually mild. Screening tests show a normal platelet count and possibly a slightly prolonged partial thromboplastin time. First, thrombocytopenia. It is important to check the platelet count before performing a bleeding time. A platelet count of less than 50 times 10 per liter is generally considered to prolong the bleeding time. Primary hemostasis bleeding time should not be performed on patients with thrombocytopenia. A prolonged bleeding time with a normal platelet count is very significant and indicate a qualitative platelet disorder. In disorders of secondary hemostasis, bleeding time is almost invariably normal. Qualitative platelet disorder. It is inherited and acquired platelet disorder including the use of antiplatelet drugs such as aspirin and clopidogrel will prolong the bleeding time. However, the bleeding time cannot reliably predict the risk of perioperative bleeding in patients taking these drugs. Qualitative platelet disorder are suggested by a prolonged bleeding time or clinical evidence of bleeding in the setting of a normal platelet count and coagulation studies. They are most commonly acquired but can be inherited. Lastly, severe anemia. In patients with anemia, there is a change in the distribution of platelets and a decreased interaction of the platelet with the vascular endothelium resulting in a prolonged bleeding time. Correction of the anemia will improve the bleeding time. People who bruise or bleed easily and develop anemia may have problems with how their blood clots. In essence, low oxygen level caused by anemia have the ability to halt or slow the wound healing stages, which leave patients more susceptible to other complications such as wound infection.
The bleeding time test is useful for testing platelet plaque formation in the capillaries to aid in the diagnosis of patients suspected of having a bleeding disorder. The test is performed by making a minor standardized incision in either the forearm and recording the length of time required for bleeding to cease. The duration of bleeding from a punctured capillary depends upon the following factors: quantity of platelets, quality of platelets, and the ability of the blood vessel wall to constrict. The bleeding time is one of the oldest hemostatic testing methods which is currently used in various medical fields. This testing is used to explain bleeding phenomenon in patients with primary hemostatic defect. Nowadays, the indications of bleeding time are very limited due to its poor sensitivity and reproducibility. More sensitive and specific assays are developed for the diagnosis of specific conditions. To obtain the accurate result, an appropriate technique for bleeding time should be performed. Currently, the template method is the most preferred method because it is a well-standardized procedure. In special situations such as pediatric cases, the bleeding time should be performed in an appropriate modified technique. The equipment such as stopwatch and sphygmomanometer must be calibrated regularly to ensure the good quality. To interpret the results, a local reference range should be applied. Abnormality of coagulation factors could also prolong the bleeding time. So, clinical manifestations of the patients must be carefully reviewed along with the interpretation of the bleeding time. The bleeding time is measured as in the Duke method. The procedure should be discontinued if the bleeding does not cease within 20 minutes. A single measurement is acceptable in some centers, although the test should be repeated when the result is abnormal. The IV bleeding time is superior to the previous Duke method in that it provides much more sensitivity and reproducibility of the result by standardizing the capillary tone. However, poor reproducibility still occurs because of the variation of the size of punctures performed by the different operators. That's all from us. Thank you.
Stop. We are not done yet. Here, there are some precautionary steps that students should alert, such as determine the patient history concerning aspirin injection to ensure quality result. Aspirin block the formation of thrombosin and protocyclin in both platelet and endothelial cell. This results in abnormal aggregation of the platelet. Damage from aspirin affects the platelet for its entire lifespan. Therefore, bleeding time may be prolonged. Perform puncture properly. A puncture that is too shallow, too deep, or in an appropriate location will adversely affect test result. Alcohol must be completely dry before making the puncture. If residual alcohol is on a puncture site, the bleeding time will be prolonged. The timing of the procedure must initiate simultaneously with the puncture. Do not touch filter paper to the wound. The platelet clot may be dislodged, causing falsely elevated result. Calibrate stopwatch appropriately. Direction of the incision should be consistent. A horizontal incision gives a longer bleeding time than a vertical incision. Bleeding time prolonged in thrombocytopenia. Certain drugs like Plavix, which are a platelet inhibitor, can falsely prolong the bleeding time.